Hi, my name is Molly and I'm going to be your student nurse today. I'm just going to be helping educate you on insulin and how to inject it so you can safely do this at home. One of the first questions we just want to ask ourselves is, okay, why are we taking insulin? And that's because you have type 1 diabetes, which means that your pancreas no longer creates insulin, and so we have to artificially put that in your body. What insulin is used for is to keep your blood sugar levels normal. And so when your blood sugar gets too high, and there's too much sugar in your blood, which is usually above 110, we have to start putting in insulin in order to bring that back to level. And what insulin does is it takes sugar out of your bloodstream and actually puts it in the cells and later uses that for energy to do what you need to do. So then another thing that we also kind of want to talk about is side effects, because that's important. The main side effect that we're paying attention to is hypoglycemia. Hypoglycemia is when your blood sugar drops below 70, and this can get really, really dangerous because the signs and symptoms of that are dizziness, fatigue, your vision can start to get blurry, you're cold and clammy with your skin, and you can become diaphoretic. So, and then if that goes untreated, you can even pass out or even go into a diabetic coma, and worst case scenario, death can occur. How we treat that is do not take any more insulin, and you're going to take quick sugar, usually 15 grams of carbohydrate. Usually you can do that with 8 ounces of orange juice. If that doesn't work, you should have a glucagon pen on you that you should be able to inject. If that still doesn't work, then you need to go seek medical help, emergency help from a hospital. Some other things we kind of want to talk about are contraindications, which just means things that we would also look at alongside your diabetes diagnosis, which is if you have any renal or liver failure or any of those diseases, it would just require modified doses in how we would approach your insulin take. Interactions, drug on drug would be other BP medications because blood pressure medications are with the blood. Corticosteroids, it can make the insulin work differently in the body. And atypical antipsychotics and other anti-diabetic medications, we would want to pay attention to all of those if you're taking any of those together. Herbal interactions that you can have are garlic, ginseng, and bilberry. We would recommend you don't take those just because it can mess with how the insulin is absorbed in the body. So now that we've kind of gone over some of our warning signs and things that you need to pay attention to as we're taking it, let's go ahead and look at how we're going to take it. So first thing is first, you want to get your stuff together. This is going to be our patient today, Mr. Zebra. So first we have our insulin, and insulin needs to be stored in the refrigerator to keep it safe and also to keep it from going bad too quickly. We also need our antiseptic wipes because we're going to use that on both your skin and on the bottle. And you need your insulin syringe. Usually looks like this. They can also look a little bit smaller like this. It just depends on the measurements that are on the side. This is how we're going to be injecting insulin, is through a sub-Q needle. And we also want a sharps container because we want to be able to dispose of our needle safely. So what we first want to do is pick a site. Usually you can use the back of your arms, you can use your thighs, your stomach, and sometimes even your bottom here. We're going to use Mr. Zebra's arm today. So first, what we want to do is scrub the hub, is what we call it. And so we're going to clean the insulin top. That just gets rid of any germs that could possibly be on there because it's been exposed to the outside world. Okay, we're just going to throw that out. And then what we want to do is go ahead and we're going to pull this out. We're going to act like we're giving 10 units. So that's what our dose is going to be right now. We're going to pull air into our vial of 10 units, just air. Careful with your needle not to stab anybody or yourself. Inject that air into the vial. Make sure not to bend the needle as you pull this up, because once we pull out what we want to take, which is the actual insulin, we just don't want to bend that needle because we're about to put that in our body. We're going to pull out 10 units of insulin, just like that, okay, and put that vial there. Now we don't want to recap, but because I'm about to not use the needle at the moment, I'm just going to put it right here so that the needle's not exposed. Next, we want to clean Mr. Zebra's arm, where we're going to inject right here. Just make sure it's good and clean. We can throw that out. And we don't blow on this, we don't wave it, we just wait for it to dry. So we wait. Once it's dry, then we can go ahead and take our needle and hold it like this, kind of like a pin. And then we're gonna pinch Mr. Zebra's arm right here, and we're gonna inject, okay? And then we're gonna put the insulin in, and then we're gonna count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then we're gonna release and remove. Counting like that just ensures that we aren't losing any insulin and that it stays in the body. Most needles that you get in the hospital will come with this so that you can cover over the needle. Some needles that you'll get at home won't have that, and so you'll just automatically put that in the sharps container so you don't have to worry about it. It's important to dispose of our needles safely so that they don't stab anybody. We don't have any issues with them. And then again, want to store that back in a safe place. And then now that he has taken his 10 units of insulin, we'll want to monitor his blood sugar and just make sure that it comes back into level of what it's supposed to be, between 110 and 70. If he goes too low, then we want to start doing stuff to take care of our hypoglycemia. If you have any questions, please feel free to ask. And I'm going to hand you a little handout with all of this stuff for quick information if you need it.